Good afternoon. Thank you very much for joining us. We're going to start on time because we have a lot to talk about today, and I don't want us to miss out on any of the possibilities for the conversation. So I'm Barb McQuarrie. I'm the Community Director at the Center for Research and Education on Violence Against Women and Children. And on behalf of the Neighbors, Friends, and Families campaign, I really want to thank all of you for joining us today. I've got the chat open so I can see even from there that we've got people from all across the country. Some of you I've known, so hello, and nice to meet everyone else too. So our webinar today is on how dentists help protect smiles and possibly save lives by knowing signs of abuse and working with multidisciplinary partners. Just as we start, I want to acknowledge that wherever we are on Turtle Island today, we want to acknowledge and thank generations of Indigenous people who've cared for these lands. And we want to celebrate the continued strength and spirit of Indigenous peoples. As settlers, we are committing to make the promise of truth and reconciliation real in our communities. And in particular, we're committed to working for justice for murdered and missing Indigenous women and girls across the country. So our presentation today will be an hour long, followed by 30 minutes for questions and answers. So I'm going to ask you to please type up any questions that you have for our speaker in the Q&A box at the bottom of your screen. And we'll remind you of this again at the end of the webinar. I'll present your questions to the speaker for his response. That way, if we have more than one question that's very similar, we can summarize it and ask it together. The presentation will be recorded. Thank you, Frank, for allowing that. And it'll be available on our website within the next few days. And now I'm honored to introduce our speaker. Dr. Frank Stetchley graduated from Western in 1967 before attending the dentistry program at the University of Toronto. Now retired, he had a general dental practice in Hamilton, Ontario. He was a part-time treatment coordinator and restorative instructor at the University of Toronto's Faculty of Dentistry and George Brown College. He's a past president of the Hamilton Academy of Dentistry and Ontario's provincial dental regulatory body, the Royal College of Dental Surgeons of Ontario. With interests in both forensic and sports dentistry for over 40 years, he has dealt with cases of product liability, mass disaster, training and response, homicides, and various aspects of victim identification. He has dealt with many cases involving victims who were children, those impacted by spousal and domestic violence, seniors, and human trafficking victims as well. Of 256 forensic dentists who volunteered and responded in New York at the World Trade Center 9/11 disaster, Dr. Stetchley was the first of only 10 foreign dentists and the only Canadian invited to join New York City's dental identification team. So we're really very lucky and very pleased to have you with us today, Frank. And I'll turn it over to you.
Thank you very much. I appreciate that. And to all the attendees, thank you for attending. And right off the bat, I realize time is limited a bit, but if there's any questions you have, there's some handouts that are part of this presentation. My email, my cell phone number and text are available. Please contact me anytime if I can help in any which way, no problem at all. So again, thank you very much. And as a dentist, and actually any of the dental staff, ever since the beginning when we first wanted to go into dentistry, and this would apply to any of your various modalities, whether it's law enforcement, children's aid societies, social groups and so on. But what we were taught from the first time we walked into the four walls of the college was to ways to save and protect the teeth and the smiles of our patients. This presentation today will show all of us how we can combine our various modalities, the various jobs that we're in, and come in as a actual team, especially when it comes into abuse recognition, domestic violence prevention, and so forth. So that's kind of what we're going to highlight here all the way through. Initially for the neighbors, friends, and families groups in London from the University of Western Ontario, uh, very sincere thank you for making this available. But at the same time, in your handouts, the NFF has loads of pamphlets, all kinds of material that is useful for you in your various modalities. And again, whether it's law enforcement, whether it's shelter groups, children's aid societies, and so on, we have to work together. And the more we can gather information like this, it really does help things out quite a bit. The main goal today, I've already kind of highlighted the professions, taking my profession, going together with your profession. Each one of us have unique knowledge bases that pertain to one way or the other for abuse recognition, domestic violence, trafficking, and so forth. It's important that we share that knowledge with each other to assist the victims. Ultimately, our ultimate interest and purpose is to save and protect the patients and the clients that we do have. We're going to do that by recognizing key signs, and key signs in dentistry may not be the key signs in massage therapy or chiropractic and so forth. We have to, again, share that information back and forth, and at the same time realize that there are mandates, basically laws that we as healthcare professionals, as various modalities dealing with the public, that we must abide by, and I'll highlight some of that at the same time. When we look at forensics itself, there's so many different multidisciplinary modalities there, and this is a list of some of them. Obviously, dentistry in the green, and but all the rest, we have to work together. There's different groups in there that I've worked with that I never in my life ever thought, why would I have to bring dentistry into engineering, for example? Well, we really needed a lot of that in New York, for example. So, but with that, when we're dealing with patient abuse, domestic violence, trafficking, and so on, these are the team members that most of us are going to work with somewhere along the way whenever we're called in for a case. And we have to share that information back and forth and work together. And everything from tutoring, from music lessons, for example, are listed there. It's amazing how many times that's what sparks the area of abuse investigation. So as a multidisciplinary team, if we respect and understand each other's modalities, what our knowledge bases are, as long as we can educate each other, we can work as a team for the benefit of the victims, be it child, adult, seniors, or whatever. So as a healthcare professional, and again, not just dentistry, but anything medical, dental, chiropractic, massage therapy, lab techs, and so forth, we all have a basic background in healthcare. We have to understand, however, the multidisciplinary roles, which I've already talked about, the working knowledge of record keeping. All of us have to have exact records, especially in today's litigious societies. If we can't back up what we did and how we did it and so forth with records, it's going to be paramount. Courtroom protocols, everything from malpractice to actual civil or criminal cases. Appreciate constraints. I have to understand that I'm not going to work as a dentist in my own office. I might have to be called to the coroner's office. I might be at a crime scene, for example. And with that, there's different ways that we have to address that at the same time. But highlighting, especially the paying attention to detail, whether it's record keeping, whether it's what you see, this is what we need to do. But again, we have to work within our mandates, everybody working together, the law enforcement personnel, the EMS people, the CAS, and so forth, all the way along. I kind of affectionately call the dentistry the drill, fill, and bill aspect of doing dentistry. But when it comes to abuse, it's the victims that we have to look at. Being able to detect and report and intervene as necessary, to look at pattern injuries, whether it's a bite mark, whether it's something else, and you'll see some examples of that later on. Ultimately, when we see an injury, we have to decide, is this really an accident? Did the child fall off a bike, or in fact, were they abused in some way, and using the accident off a bike as the excuse? Litigation, as much as we look at abuse that way, it's amazing how much the abuse works against us. In civil litigations, it works both ways, and people sometimes don't look at that. But the other aspect is you might have a police officer coming in with a warrant and asking for your dental records, for your medical records or chiropractic records, for your, if you're a teacher, for example, of how that child was being taught and so forth. And this is all part of our roles. But record keeping is really what it's all about. In dentistry, I feel that of all the healthcare professionals, we're probably the best. The people come back to us on a regular basis. We have routine records that we take and we keep for at least 10 years from the date of the last appointment. That's the college rules. And we record different things, whether it's on paper, computer, or even by radiographs. So let's take a look at dentistry right now. As far as that one modality, how does dentistry work with all of you out in the various fields, the healthcare field, the law enforcement, children's aid, EMS? I've worked a lot with the paramedics. Remember a couple of cases, even when they're in the ambulance and you hear the siren in the background, they're saying, can you meet us at the hospitals? Women's shelters. There's one that's just a few blocks away from us here in Hamilton, and various ways how dentistry can assist all of you. So injury recognition is the main fact that we can look at. A lot of abuse deals with injuries, and it's your suspicion of that. And our priorities, our mandated priorities, is to respond to any questionable injuries. Again, where I was saying, decide, is it an accident or is it an abuse? And we work together and educate each other within that. You'll see this a couple of times, as I know that there's going to be a few slides that come up that are fairly dramatic and they're vivid and graphic. Might be upsetting to some, but the warnings are there. So what do we look for when it comes to injuries? The pattern recognition. Bite marks are a definite pattern injury. They can cause a bruising pattern the same way that the cord there, for example, can leave a definite pattern. And again, those two cases that you see to the right, abuse or accident. The one on the left is an abuse case. The one on the right, in fact, he did fall off a bike, but they look very similar. It's being able to spot things in that regard. A lot of times I've been called to the hospital just to take a look at Susie here. And people say, well, what are you calling a dentist for? You mean tell me a dentist can tell us who hit Susie here and caused her the two black eyes? No, but if we look at different injury patterns, a dentist can recognize two bite marks, one on the forehead, one on the wrist. Chances are whoever gave those bite marks, they'd be my primary person of interest in regards to, who could have done the abuse with Susie here. Things that are fairly evident to us. We can look at linear striations on the side of the face. Think outside of the box. What could have caused that? And in our field itself, head and neck areas, in dental, that's our scope of practice. Look behind the ears. It's amazing how many times we found bite marks and different patterns on the ear. How many times we've seen torn earlobes because of earrings that were there and basically ripped off during the assaults. Age determination, had several times where the Children's Aid Society, some of the law enforcement come in with skeletal remains, and we're able to tell within the baby dentition to the mixed dentition, kind of baby teeth and permanent teeth, and then also the permanent teeth. From about 12 years of age and under, we can probably narrow things down age-wise to within a year, 6 months to a year. And after about 12, 13, 14 years of age, and for the rest of the adult dentition, we can narrow things in within about 3 to 5 years as far as the age of that individual. And that may become pertinent into a case as well. DNA collections. This is a female breast, and during a sexual attack, the red arrow shows a bite mark. And where there's a bite mark, we're also going to have saliva, the spit, if you will. And where there's saliva, there's also cells, mucosal cells, which have DNA. So if I was called in on the case, first thing I'm going to do is take a DNA swab of the nipple area there before I even start looking at the aspect of a bite mark. In the year 2000, the Child and Family Services Act at that time designated dental neglect, the cavities and so on, as actual child abuse. I've heard this, and I'm sure the dental people in the audience, well, just doctor, they're only baby teeth, we'll just let them go for now. We'll worry about the permanent teeth when they come in. No, you can't do that. If in your judgment that fillings have to be done, extractions have to be done, and so on, this has to be taken care of. If the parent, the guardian refuses, it must be reported to the Children's Aid Society, the police department. That now is child abuse. To the right-hand side, this was a patient of mine, 4.5 years of age. Literally, we had to take every tooth out. It was just so badly rotted out. And this is what happens in the real world. Police officers, investigators for major crimes and so on, victims of major crime. The abusers now are getting a little bit more sophisticated. They watched a lot of CSI and all these other programs. They know of how not to leave evidence behind. But I still say, and I've had this happen where police officers come up and say, Doc, we really believe her, she was assaulted and so on, but there's really not much physical evidence. And I say, wait 24 to 36 hours, then take a look. That's when the bite marks come up. That's when the pattern injuries start to show. So it's important to follow up, not only in the body, but look in the mouth. This is what we call petechial hemorrhages in the junction of the hard and soft palate. And, sucking on the penis will cause this to happen. I'm, I'm told that this happens routinely with some sexual relationships and so forth. But when it doesn't happen, if it happens to a victim 16 years of age and under, this is a sexual attack and assault, must be reported to the police and the Children's Aid Society. But at the same time, take a photograph, because that disappears fairly quickly. Within 6 to 8 hours, that's going to be gone. You'll see another image of intraoral lesions as well. Senior abuse. So this is a 92-year-old female. She was bitten on the arm by somebody, and the arrow shows the lower teeth. They have the power of the bite, and they actually penetrated through the skin. The other bruising at the top is the upper teeth. The medical people put a drain in there because it got badly infected and so on. 5 weeks and 2 days later, she died of the infection that was there. This is still, in my estimation, a homicide. And that's how things can, go along quickly. But unless we work as a team, medical talks with dental, talks with nursing, talks with everybody else, we have to work as a team. Otherwise, for all intent and purposes, that injury just did not exist, and yet it's a homicide. In your handouts, you'll see this. I'm not going to dwell too much on it, but it's an interesting article of a case that the senior abuse officer with the police department here in Hamilton, her and I worked up a program, and it is worthwhile. And you can easily take this. This is now in a digital format. You can kind of cut and paste it to go to your community. The dental field, we now have updates. Last week, I think I got 2 of these requests for assistance. About 2 years ago, I approached our registrar and said, a lot of police are still asking me how to gather dental records and so forth. And whether it's in Thunder Bay, whether it's in Windsor, it doesn't matter, Vancouver or Halifax, St. John's, all the police are having the same problem, getting dental records. And what we do there is the police officers locally here would contact our registrar, and this is sent out to all the dental offices. And all we need to do, especially now with computers, put in the person's name, the birth date, and the computer can search right away to see if that person's ever been maybe just for an emergency examination once or other treatments. So we can do that. Human trafficking, ironically, just this morning, I got a CBC blast from the Waterloo Police Department. They have 75 cases of human trafficking going on in the Waterloo area, and they've started a brand new program there, and I haven't had a chance to really follow through on that, but things are happening extremely quickly. And it happens along the 400 series highways. What I have marked here is the border crossings that with the United States, these are heavy traffic areas as far as trafficking goes, especially for younger girls, especially, but also the boys. The yellow areas are transfer points between transport trucks and commercial traffic and so forth. It's amazing. And you can see the one on London there. Well, I guess we can also add Kitchener-Waterloo area to it. And the en route rest stops that you have along the 401, the OPP started this back in July of last year. And so far, the statistics are that, especially the girls 18 years of age and under, they've had 68% of the cases are dealing with trafficking in that area. And if you go to the en routes, I was at one there, and because of COVID, it's kind of closed off, but the TVs that they have, this is a video that keeps on going, and it shows you different things. When you see something like this, contact the OPP. Traffic cam, that's, again, the police are working with local hotels, motels, and so on, where a lot of trafficking happens there, because as the people are trafficked down the 401 series, overnight they're going to go into a hotel or motel. And this is a phenomenal. I got some information there too that you can look at that and see how that works. The police can narrow it down almost to exactly which Holiday Inn or Sheraton hotel it was at and so forth. It works well. Statistics Canada, a lot of the stats show that about a little more than a third of all the crimes with violent crime with police is dealing with domestic violence. 84% of those occur in the family home area. About half of the victims have physical injuries, but this was interesting. 84% of the abusers hit or bite, And again, if the law enforcement officers don't see a pattern to that injury, be it a bite mark, be it you'll see a belt buckle shortly, and so on. But now with COVID, though, this has taken out some of the recent stats, 54% increase in the domestic violence calls. And just yesterday, in fact, I saw it, 81% increase in the child abuse and exploitation online programs, all because of COVID. People are in their houses now. So when it comes to victims of abuse, my youngest was 7 days of age, my oldest was 97 years of age. But I hear this all the time. Well, that doesn't happen in London. That doesn't happen in Hamilton. That doesn't happen. It happens everywhere. And this is the sex offenders that have been convicted and so forth. This back in 2015, 5 years ago. And essentially, if Toronto says it has 403 back in 5 years ago, you can almost take that figure now, multiply it by 10. And so they got over 4,000 now in the Toronto area. But just the Golden Horseshoe already today, there's about 8,000. They could be your next door neighbor, and we have to be aware of that. So when we come to abuse indicators with the dental field, I tell the dental professionals, the areas to the left, you can look at that. We're trained on how to fix these things up one way or the other, either refer them to a specialist and so on. But when these people come in for a fractured tooth or bleeding lip or something like that, look at the orange ones. These are the areas that should kind of trigger your suspicions. Are we dealing with an accident, or do we have an actual abuse case? The biggest one is the fear of the guardian in the treatment room. In all my time in practice, I never allowed the guardian into the operatory. I often say I've done hospital rounds and so on, and a lot of times the kids come in, they fall off a bike and they need 10 stitches in the arm. The parents and the guardians are not allowed into the emergency rooms, operating room where the stitches are put in. They sit out in the reception area. The nurse will bring the child out and explain what needs to be done. Why do we allow them into the operatories? And I'm not just talking dentistry. This is medical. This is everything else. The guardians do not belong in the privacy of your operatory. When you're dealing with a patient of any age, you're the professional, you got the patient. We have various privacy laws that I'll speak to later as well. Promote that privacy at the same time. A lot of barriers that we as healthcare professionals have: time constraints. We're all busy. We can't be bothered. We'll worry about that later on and so on. No, a lot of it, though, relates to the other 3 points. Lack of training. They don't know when they do find something they're suspicious of, who do we refer to? And I'm stunned by the fact that at least half do not realize it's their mandate. By law, they have to report to the various authorities when they suspect abuse. And why is that? This is an article out of the Hamilton Spectator teaching how to spot evidence of abuse should be standard curriculum. It is not. In today's world, with the hashtags and so on, all the modalities that we have, the multidisciplinary faculties and so on, must, in my opinion, teach the signs and symptoms of abuse. Otherwise, we're going to be lost. Jocelyn, I've worked with her before. She's a lawyer out in BC. She, in her articles, students are not educated on the warning signs and the common risk factors for domestic violence. And she's a high proponent. All the faculties have to teach this, whether it's colleges, universities, and so on. Even the Journal of Dental Education has said the majority of domestic violence victims were not asked about their injuries by the dental professional, even when the signs were apparent. And the reason was because a lot of times the students are not taught on asking the right question. As a healthcare professional, you are asked to check the medical history of any patient, any client, before you treat them. This is a model or an example of my sheet that I had in my office. It is also part of your handouts. The part with the blue is ask the question, child abuse, family and domestic violence, spousal or partner abuse. The red is 11 different corollary questions. And I find that if they answer one of the blue questions or 3 or more of the red questions, chances are we're dealing with an abusive situation. And again, you do this without the guardians in the operatories, and also with the women if they're pregnant. There's a spot that's blank there. I leave that purposely there. If they're pregnant, a lot of the domestic violence victims, being women, happens during the pregnancy. So now I get into the aspect of asking them more questions. So the histories have to be done in private. The FIPA, the PETA's privacy programs we have basically says no guardians are allowed in the operatory. COVID, ironically, is really helping in that regard because in dentistry, anyways, guardians are not allowed into the operatory with COVID. The guardians are told to stay in the reception area, or most of them stay in the cars, and then we text or call them when they can come in and take the patient back out. So COVID is really helping out. But the thing is, we have to, as healthcare professionals, even as law enforcement and so on, and I thought this quote really speaks volumes. We have to, be aware of the issue that, you know, look, the issue of abuse is thinking it's not your business because it overcomes an issue of an individual's safety and well-being. Domestic violence has to be seen as everybody's business. You have to overcome those emotions that, it's not all about you. It's not all about your office. In fact, if anything, you show the patient that you're concerned. I'll speak to this later. It's an excellent practice builder. Police officers, it isn't in your handout, but if you contact me, I prepared this with an OPP officer about 30 years ago, and it's a collection of dental evidence for other people in different modalities. You might be a massage therapist, a chiropractor, pharmacist, whatever. Police officer could come with this information here, but especially for the dental, we have warrants that will ask for not just records and so on, but this is specific to dental evidence. And so with that, I mentioned already the request for assistance from our own colleges. That's part of the mandated ways that we can assist, but the record keeping and in the warrant that we have for dental evidence, the records that we have, officers are allowed to collect the paper, the computer records, everything. We have to keep it as healthcare professionals, hygienists and dentists. We have to keep our records for 10 years from the date of the last appointment, any insurance papers for 2 years. That's mandated by our colleges. Record keeping is basically everything, the notes, the x-rays, photographs, everything that we have, we keep. Photographs can easily be taken. People always ask, can I take a photograph? Yeah, that's part of your record keeping. And when it comes to abuse aspects, basically use whatever you have. If you don't have an intraoral camera, the cell phones, it's surprising. I've had a lot of convictions that we got just from the cell phones pictures that were taken and so forth. But take an overall body view so we know exactly it's the right arm and this is where it's located. Take a closer up view with even a just ordinary ruler. We can start measuring the area there. If it's dealing with bruising, getting this is a Kodak color grid, but anything that we can keep to match the colors with really does help out. You probably saw this on different programs on TVs and so on. APFO, American Board of Forensic Odontology, it's a ruler developed by two dentists. And basically with a human bite mark, eye tooth to eye tooth cross arch is about 3 centimeters, might be 2.7, might be 3.2. But as a rule of thumb, if it's 3 centimeters across from eye tooth to eye tooth, we're dealing with an adult bite. So when you see something like this, the blue is the upper arch, the red is the lower arch, heavier bruising, but you can see the 3 centimeters down the bottom tells us right off the bat, this is probably a adult bite. When it comes to soft tissues, a lot of the bites are on the female breast, on the buttock area, on the shoulders. Again, softer tissues, and things move a lot. There's a technique where we can get this down to a one-to-one image, helps out immensely in the investigations. Aluwax, a bite registration. The police officers locally that have this, very easy to use, and the persons of interest would bite into that. If you have 10 persons of interest, it's a great way to start screening some of these people out. It's important as important to say this is the person that did the biting as it is to exonerate the other 9 that are not the biters. But you can see when you bite down, the eye tooth where the green is actually has a point to it. The eye tooth on the other side is probably chipped off or worn down somehow. It doesn't penetrate down through the wax as much. Where you see the white shining through the wax, that's what the human bite will look like in a pattern on the skin when the bruising happens. So it gives you a good screening device right off the bat. The dental healthcare professionals are told to get some models. We usually take what we call alginate. It's a quick and simple way to get a model. Polyvinyl siloxanes is another material. Now we don't even have to take models. We can do it by digital scanning itself. But you can see from the left to the right, the adult dentition, the mixed dentition, maybe a child 10, 12 years of age, and to the right is the child 5 years, 4 years of age dentition. Upper and lower arches, all different from the other. Taking the salivary swabs, the warrant also allows us to do that. But with all the abuse, We talked about physical abuse, and it is probably the most common, and worldwide all the studies show a little more than a third of all the abuse that can occur is all physical abuse, which really goes into our bailiwick. But so with that, if we start looking at the abuse, again, 65% occurs in the head and neck area. That's the dental professional's domain. And when we look at the head and neck area, and these are all cases of mine that I've had, yeah, it's everywhere from broken teeth to behind the ears, the bruising patterns and so on. Look everywhere and document it with the photographs, with the scales and so on. Another 24% occurs in the arms and legs. And again, cases that we've had, and take a look at it and document it down and so forth, again, with the scales and so on. So if we take a look at things, the one on the left, 7-year-old patient of record of ours, she had a lot of facial injuries, but also it doesn't take you don't have to be an orthopedic surgeon to see there's something wrong with her right arm. She had a spiral fracture there. It was in pain. She came in for regular dentistry. We stopped the procedure, didn't even do the procedure. We just went and activated the system, and she was the victim of abuse. To the right there, just the binding, the bruising that's there. I'm not the investigator. That's the police officers and everybody else's job. When we suspect something, we report it, let the multidisciplinary team come in and start doing the work. But if we take the 65% in the head and neck, 24% in the arms and limbs, 89% of all physical abuse is easily viewed by any of the modalities that we deal with. If you're dealing with a patient, with a client, with a victim, it's easily viewed if you know what to look for. Best thing there is to take a look at the injury pattern. Does it match the history that they're telling you? If the child fell off a bike, they might have, injury patterns where they, face smashed into the concrete and so on the sidewalk, but they're also going to have injury patterns elsewhere on their body. If there's no other injury patterns, they didn't fall off a bike. Again, with dentistry itself, the red arrows are the hard tissues, the teeth and so on, jaws. A third of the injuries dealing with hard tissues. 2/3 of the injuries deal with soft tissues, the lips, the cheeks, and so forth. They cause bruising, and it really stands out quite a bit. But when you look at bruising patterns, I've seen this happen more often than not, and so does the Children's Aid Society and the police officers and so forth that are in the audience. Rarely is it just one type of an injury. The red arrow is cigarette burns. The green one is a bite mark. So what do we look at? What type of injuries do we look for? Very minorest of injuries sometimes tell us a lot, the most of it all the way through. You saw the dental decay one already, the neglect. The one to the right, the sexual, this is a 12-year-old female patient of ours, and when I had the practice, and she was going out with a 14-year-old boyfriend and sucking on his penis, but he had venereal disease, and sexually transmitted diseases are there, and that's the way that we can spot things sometimes. Cigarette burns, it's stunning how many times we've seen this, and again, that's not my job. I see that, and we report that accordingly. Type of injuries, contusions, basically the bruising and so on. Take a look at the bruising on the skin, but also in the mouth itself. It's important for the investigators to know, is it the right eye, left eye, both eyes, upper, lower lid? Take a look at the color. If you haven't got a camera, mark down the color and so on. It tells us approximately when this could have happened. The other part is when you look at the bruising and so on, you've seen this one already before, but where the arrow shows, strangulation is now a crime. It's Bill C-75 was the federal bill, now puts strangulation, the choking and so forth of a victim, is a crime all the way through. So, but in the mouth, this is a 10-year-old boy that we, one of the cases we had was being abused, bullied by a 14-year-old schoolmate. And the bruising that you see there was, when I showed this to the hygienist who reported it, she said, Dr. Stetchy, this was worse bruise than that. This occurred before school, the day the hygienist spotted about 9:45 in the morning during examinations, what we call the DMF exams for the schools. This photograph was taken about 2 in the afternoon, and already that bruising had, started to disappear. This was more of a bruise because the 10-year-old was not sucking on the penis. With the erection, the penis was being thrust against the soft tissue. It damages it quite easily, and that's more or less a bruise in the same way that a hard object hits the skin and causes a bruise. Abrasions, again, take a look. Bad things happen to young kids. Take a look at, is it an acute one? Did it just happen where they've been bound during the night? Maybe the hands are red and swollen and so forth, compared to bruising, which is a chronic situation, happened maybe a couple of days ago. but this happens, and this is happening in your area. A 7-year-old patient of ours could not understand what this was, and basically a male family member came in to find a job in the Hamilton area, and they kind of struck up a friendship with this young gal, and 7 years of age, and he said, "Oh, if you suck on my penis," and he rewarded her with gifts and candies and different toys and all this type of stuff. She never felt anything was wrong, nothing hurt her, but she just didn't like that slimy stuff. And this was a friction burn, basically. The CAS, I did not see this. The CS worked this one through, and I thought, wow, again, how things are there right in the middle of kind of staring you in the face, and yet if you don't think outside of the box. Lacerations, again, I asked on the left, a 16-year-old patient, during the attack, were you bitten? If so, where? Is bitten on the finger. A bite on the finger, I could not tell you that was a bite mark, but I'll tell you, it's going to take 4 to 6 weeks of antibiotics and antiviral drugs and so on. There's bacteria, there's viruses, there's funguses and so on in the human bite. It's an infection that does take a long time to settle down. Police officers, when you're investigating, ask them, the victim, did they scream out? "Oh yeah, I did, but he put his hand over my mouth." Take a look at the persons of interest and see if they've got lacerations on the inside part of their hands. Chances are a lot of times the victims will start biting there, and sure enough, that's what's happened there. Incisions, left-hand side, an 8-year-old girl was viciously attacked in Hamilton. A dental consultant was not brought in. She had a lot of injuries there, but the 2 bite marks listed in red were not even seen. And if the medical profession, the emergency personnel did not recognize a bite mark for what it is, it might well as not exist. If I was called in, we would have taken a DNA swab, worked up the bite marks itself. The one that on the arm on the right-hand side, for whatever reason, this individual that was, domestic violence, he had a little jackknife, and he really enjoyed stabbing her with this blade. And that's what is shown with the red. So even though the bruising is there, which caught our attention, and that was a long-standing bruise a few days back, but the stabbing was a fairly recent one. Avulsion, that same 16-year-old boy, this was the temple area. His earlobe is that you see there. The 2 arrows are pointing to the 2 upper front teeth, the central incisors, the Bugs Bunny's teeth, if you will. We took this a few days after the injury was there so it could heal up, but the attacker basically just bit the tissue right out. Things that look like a bite mark and are not, this is a colleague of mine down in San Diego, and he sent me this. He does a lot of teaching with the state police and the local police and so on. In fact, I showed this once up at OPC, the Ontario Police College as well. And this was in San Diego. 3 people attacked this fellow outside of a bar. He was dead on the outside sidewalk. One of the police officers saw this and called the dentist in. He took a look at it, said, "What story?" He said, "We have 3 guys that beat this guy up. Where are they?" He says, "In the cruiser." He walks over, San Diego, they all had cowboy boots on. And this was actually the heel of one of the cowboy boots. They got a warrant to seize the 6 boots. And this person would have survived the attack had it not been for this kick. This kick actually broke his neck. So how things that look like a bite mark, but actually a pattern injury, could actually put closer to a case. I find that in my time, frequency and the severity of abuse is going to increase with time. That verbal abuse becomes a shouting match, becomes a slap in the face, becomes a punch in the face. Next thing you know, 6 weeks, 2 months later, the person's on the autopsy table and said, "Oh, gee, I never thought he would do that." It's going to increase, and it does increase. So let's take a look at the Youth and Family Services Act. This was passed about 2 years ago now, and replaces the Child and Family Services Act. This is available in your handouts. If you want 1 or you want 10 or you want 100 or 1,000, it's free of charge. The information is how to order them is there. But with the pamphlet, as a healthcare professional dealing with children, but anybody who deals with children, teachers, tutors, and so forth, are all bound by this act as well. And it puts the responsibility on all of us to watch for the welfare and protection of children and protect them from harm or from risk. It lists all the professionals that are affected with this. Everybody in society is under this act. It's the suspicion that the child, you don't have to prove anything. You're not the investigator. If you sit there and state, something just doesn't sound right here. But if one of these is suspicious enough, in your opinion, you must report it. Physical harm, sexual abuse, or exploitation, Patient requires treatment for something in the health field itself. It doesn't get it. The emotional harm, you can see that something's definitely bothering them. As people dealing with the kids, if we suspect it, we must report immediately to a society, and that society basically is the Children's Aid Society or the police. Children's Aid Society for the kids, adults, the police itself as well. I'm going to speak a bit to that later at the same time. It applies to everybody in the healthcare field itself. We are all told by our regulators we have to do within our healthcare fields the duty of care. We're working in the best interest of that patient, of that client. But the Act also says we also have the duty to report. And if it's a child 16 years of age and under, by law, we must report that. There's other qualifications for a child who's between that 16 to 18 years of age. It's all in the Act. It's an ongoing duty to report. Gosh, they came in with a black eye 2 weeks ago, and now they got a linear striations and bruising on the cheek itself. What do I do? You have to report that again. And with that, if my assistant comes up and says, gee, I've noticed this bruising on the face, why don't you go and report it? No. My assistant, my receptionist, any staff member is also a healthcare professional. They are the ones who are mandated. They cannot delegate that responsibility to anybody else. The CAS, the police officers want to talk to you because you're the first one that saw that. So you can't delegate that responsibility. They also recognize, again, I mentioned anybody who works with kids, we have to be aware of the signs and symptoms of abuse, and that's going to fall back to the faculties. We have to look at that. But the privacy aspect, well, the police can't have my records. My dental records are private, information. No, the police can take them. Our college can take the records. There's privacy supersedes anything that, the statutes have when it comes to abuse. Failure to do so, if the healthcare professional does not report their suspicions, and they will be fined $5,000 by the Minister of Health in the province of Ontario. Plus, the Minister of Health will report that incident to the college, and I, as a dentist, will be charged with professional misconduct by our college, which has its own repercussions. Nowadays, within the last 10 years, corporations have taken over dental offices like crazy. They are now also bound. Their fines can be anywhere from $50,000 to $250,000. They are also bound by the same legislation to report. Again, we're not obligated to prove the report. That's not our job. We have professionals in the multidisciplinary team that does that. Report your suspicions as a mandated reporter. We'll work with it. And I hear this all the time. Well, what if I'm wrong? As long as there is no malice in your intent of calling, nobody can sue you. You can sue me. I got a purple tie on today, and you can sue me for having a purple tie on. It's not going to go anywhere. That's been thrown right out of court. And but as much as the law says you must report, it also protects you from any liability. With the cases, any cases I've had, male, female, young, old, doesn't matter. I will not take a case on with the police, Children's Aid Society, unless I am allowed to see from the bottom of the feet to the top of the head and everything in between. That's the penis area, the scrotal sac, the vaginal area, the anal area. If I can't do that, I'm not going to take the case. And the reason being that, again, the suspicion is there. This is a 10-year-old girl, and some injuries on the face that a teacher actually saw and reported as suspicious. When we got investigating into it, the bruising is there. Also with the long bangs, sometimes if the long bangs are there, there's injuries there. The arrow shows a little scratch, but there's also one on her right forehead that was there. But the teacher actually saw under the chin, and she tried to commit suicide the night before. Of course, didn't succeed with that, but even the lobe on the earring was ripped right off. This to the right-hand side on the back, that bruise really stumped me. I didn't know what we had there. We had quite a few pattern injuries on the buttock area, but you might be able to see it here. The mom, she had a foot size 5.5 to 6, and this is the footprint of the mom. She threw the child down on the ground, stood on her back, and beat her with that, and cigarette burns were there as well. But we were able to take that and various things, same as a bite mark, trace it back down. And that just blew me away how we did that. COVID, I've mentioned this a few times before. Abuse happening in the family unit. The victims are not coming out, but if, say, for example, a toothache is very bad and a young child comes out, we should be suspicious. Gee, Susie, what happened with your eye here? You got it's a healing bruise, no question, but she had a black eye. She also has a bruise on the lip, which is fairly recent just by the color. So the bruising on the eye happened, but this bruise on the lip is fairly recent. That suspicion alone is enough for us to call the authorities, the Children's Aid, the police department, and we worked with both the police department and the Children's Aid Society. But in the hospital, this is at Children's Hospital here in Hamilton, we noticed some bruising on the rest of her body. This was a belt buckle. You can see the upper left corner compared to the lower right. And the lower right is just very subjectively. That was my tracing just to see what it was. We worked it up. We found a paisley pattern in the belt buckle as well. But we also found a bite mark, and we got a conviction on this. But unbeknownst to us, this case was started with the OPP and with the medical people, myself, and so on. A local police service had already been called about 9 days prior. They took their photographs. They did not work as a multidisciplinary team. And this just stunned us because this is the photo that they took. And again, how important it is that we work together. And that bruise on the forehead, that was the belt buckle as well. You can see kind of a bluish bruise on there. But, that's what's the way the eye got initially. And you can see how they healed it quickly all the way through. This is 2 years and 3-month-old victim that one of the cases that we had here in Hamilton. Story was that she fell down the stairs. This was not falling down the stairs. This is a bite mark. Lower arches right to the bridge of the nose. The upper teeth are at the scalp. You can't see it quite there, but the 3 centimeters is there as well. Again, excellent case that we worked with the police, the Children's Aid Societies, law enforcement, and so forth. But with that, we found injuries elsewhere. She had 13 bite marks on her, 3 of which were on the vaginal area. The upper left-hand side, that is a cigarette burn on the base of her foot. It stuns me even now when I mention it. I heard this in court that the pathologist testified a cigarette was held for a minimum of 9 seconds perpendicular to the foot. That was a 3rd degree, 2nd degree, 1st degree burn on the foot, and it just blew me away. But anyways, we the one buttock area, the bite mark we had, and worked it up, and I saw on that bite mark there's 2 things I was looking at. One was the tooth where it's got the chip on the top and the displaced tooth on the bottom, and we did a conviction there. Children without teeth, primary indication. This is the golden rule type of stuff. If the frenum, which is if you kind of lift up your lip, you got a bit of tissue that ties the lip to the arch itself. That's called the frenum. And in a child, it's very delicate. When the child is force-fed or somehow abused itself, that tears very easily. But when you see that, and one of the nurses picked up on this bite mark, which is on the elbow of one of the hands. And if you look at the green arrow, it's a lighter bruise than it is for the yellow arrow. And actually, the police officer that was called in on this was one of the students at the OPC, Ontario Police College, when she first graduated, and said she looked at it and said, it looked similar to what you had in the presentation. I wasn't going to take this case, but I took it. And but anyways, when I saw it, I said, yeah, your suspect, the upper right Bugs Bunny tooth, if you will, is chipped. And this is the way it was chipped because it didn't press down as heavily. And this is actual court documents. We had the 1-1 templates that we did and so forth, and take that, superimpose it. We had this, and all we have to prove is on the balance of probability, is this the biter. We had 4 persons of interest in this case, and this person got 5 years in prison for this. Advertisings in dental journals, what do they have in common? I figured it was a bleaching technique, all nice looking girls, nice dentitions, but they're all survivors of domestic violence, and that went on to describe what to look for and so on. But every night in Canada alone, every day, 3,300 women and bring along 3,000 kids that seek shelters in the women's shelters. About 40,000 Canadians are arrested annually for domestic violence. That's only 12% of all the reported cases. So it's out there, and no question. This I thought would be really interesting. Sting, he's the front man with the police and the group itself, not the police, law enforcement. But during a very bitter separation and divorcing from his first wife, he wrote a song. And he is an obsessive stalker, and the stalkers usually end up, with domestic violence and outside of that. But it's not a love song. But when you look at it, every breath you take, every move you make, every bond you break, every step you take, I'll be watching you, and all the way through. This is exactly what a stalker does. And when they get the prime opportunity, they're going to attack. Shania Twain, I've met with her several times. She's very active in recognition of child abuse. In her biography, with her mom was a victim. She saw her mom abused, dragging her by the hair, putting her head in the toilet. But also, he said that her dad went and cupped his hand around my breast when he thought I was asleep. She's also wrote a song in regards to domestic violence. And so this is really key in what we all have to look at. Uh, right now, I mentioned the hashtags earlier and so forth. The media, look at all the cases we've had in regards to domestic violence and everything. It is really hitting the media quite a bit. This is really, I was really excited when I first saw this. Um, and this is also in your handouts. Back in March, so literally during the COVID, um, people are at home. I mentioned this already. They're stuck at home. The abusers are keeping them there. They're locked in, basically in home being a prison. And I thought, what a great way to signal that you need some help. And the young gal here, and this could be it on the street, it could be on the computer. You're talking with a friend of yours and so on. Oh, hi, how are you? And just putting the hand up like that. But if she wants a signal that she's being abused, and in the background, if you see this on the video, the abuser is in the background. You don't see him here yet. But when you see this, and without saying anything, she takes her thumb and puts it in like this, and then takes it and clenches the fist over like that. That's the signal. You can see the abusers in the background, and basically, I need help. That's, in a sense, of a visual 911 call. If there was out on the street and the abuser is walking alongside them and so on, oh, hi, and the hand goes up, the thumb goes in and curls down, that means that person needs help. So I mentioned hashtags. Things are changing now. It's not the way it used to be. And hopefully this one woman being killed every 5 days in Canada, it'll be once every month and once every year. And hopefully in a few years, nothing at all. But in dentistry, we have what we call April is Oral Health Month. We go through, hand out free toothbrushes. We show the benefits of fluorides and everything else for the whole month. Yet, ironically, we do that to prevent tooth decay and all kinds of dental problems. Last month, however, was Child Abuse Month, recognized for years now. Children's aid societies, the police, the shelters, and so on. And yet, we don't speak about that in dentistry with the Ontario Dental Association, our college, and so forth. Ironically, November is Women Abuse Month, and the purple ribbons and so forth. And why not make this evident? Advertise the fact this is what we're looking at as healthcare professionals, as people that deal with the different modalities and professions, dealing with patients, with clients. We are there to help these people out. Going to finish off now. This, if anything, when I had my practice and the police officers, the children's aid and so on, but especially the police officers, children, we must by law report 16 years of age and under, otherwise we're penalized. Adult is different. We have to get permission from the adult to report the abuse. And with that, if one case that I used as the example, patient came in, never saw her the once, and that was it. But we got a lot of referrals with the practice from the hospitals. They had been to the hospital missed this completely. She was referred to our office. They came in, my staff noticed it right off the bat. They said, I think we got an abuse case. And we had a protocol. It's like, not kind of a lockdown, but something similar to that. And this is back 25, 30 years ago, we were already doing this. But anyways, the lady came in, she had a kind of a red blemish or a bruise on her left cheek. The tooth was the first molar on the upper left-hand side. And she said that she bit down on something very hard and it smashed this whole tooth. And we took an x-ray. We had to remove the tooth. It was in 27 different pieces. That's how badly smashed it was. Biting down on a cherry pit in a pie is not going to do that. But when I saw the bruise on the cheek and obviously the tooth, we put the freezing in, told her it had to be taken out. While the freezing was taking place, Again, the actually, ironically, the abuser was actually in the reception area. We gave him a coffee and so on. And he wanted to come in. He said, "No, we don't allow that in." And anyways, myself, my assistant, and the patient. And what I said to the patient, I said, I really do a lot of dentistry outside of the field, but also into the abusive areas. And I'd like to ask you 4 questions. And she looks at me and says, "Okay." And I said, "I got some rules though with the questions. I want you to answer me just with a yes or a no, but that answer has to be the truth." And I said, "Yes, you understand what I'm asking you?" I said, "Yeah." I said, "The reason I'm asking you that, I see a reddish blemish on your cheek. The tooth is smashed. I don't think you bit on a cherry pit in a pie. I'm suspicious." And the 4 questions are after my suspicion to you. So again, I'm going to ask you 4 questions, yes or no, but it has to be the truth. My first question to you: you say you bit on a cherry pit in a pie. I don't think that's what happened. So my first question to you: yes or no? Did you in fact bite down on a cherry pit in a pie? No. I said, "Thank you very much for being honest with me." I said, "From what I see here with the bruise on your cheek and with the fracture that I got here, uh, my second question, yes or no, I feel that you were assaulted. My question is, were you assaulted? Yes or no?" Yes. I said, "I'm sorry to hear that." My third question, yes or no, but I need the truth. You say that you didn't bite on a cherry pit in a pie, and I always repeat this. You said that you were assaulted. Do you know your attacker? Yes or no? Yes. And I said, "Okay." My fourth and final question, I need a yes or a no, but I need the truth. Are you prepared to lay charges? And I get a violent reaction. The hands go up. "No, no, 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 no. I don't want to do anything." And that is a normal reaction. I say, "I was hoping you'd react that way." And they look at you kind of funny. I said, "What do you mean?" I said, "You were attacked. You are the victim here. And don't let them get away with this." I said, "I'd like to gather more information from you now at no cost to you." If they got dental insurance, I say, "I'll charge for the emergency examination. I charge for the x-ray. I'll charge for the extraction of the tooth, but nothing else. But I want to get some further x-rays. I want to get photographs. I want to get study models, whatever else I feel I need." And we get that information. And I said, "But I want you to promise one thing after that." I said, "What's that?" "Whether it's 6 days from now, 6 weeks from now, 6 months from now, you decide you want to lay charges, please mention to the police officer I have information pertinent to your case. Because if 6 months from now you decide to lay charges and it goes to court, it's going to be he said, she said. And you say, well, hold it. He punched me so hard I had to have a tooth extracted. He's going to say, she doesn't keep her teeth clean and so forth. No wonder her tooth rotted out. She had to have it out. What proof have you got? My records will show that I was the one who was suspicious. These are the questions I asked. And this is the photograph. These are the extra x-rays and so on. Now you have evidence that, in fact, you were assaulted. I've had many times the police officers come in, sometimes a couple of years after the fact, with the warrant to take a look at the files. I've forgotten even the name. I look at it and I ask the police officer, just promise me one thing. When you find out the result of that, can you let me know, did she win, yes or no? So far, we're batting 100%. The women now had proof that they were, in fact, assaulted. And that's how we can take my profession of dentistry, apply it to the other professions. So with that, with the information, again, I apologize. It's like a stone skipping over water. We hit all the high spots. I have actually a program where I break it down into 3 1-hour sessions. But, in your fields itself, research the information you had here, work together with your local dentist, your local chiropractor, physiotherapist, massage therapist, any of the healthcare fields itself, the pharmacists and so forth, the shelters. And what I've done in my office is, instead of having, we usually had a 45-minute lunch, we made it a 2-hour lunch. I brought the pizzas in and all that. And we had the intake worker from the Children's Aid Society. We had one of the people from the women's shelters come in and speak to us. We had the senior abuse officer with the local police departments come in and speak to us. I'd like to know what I'm getting myself into, as well as my staff into, because I got to protect them as well as the patient from the abusers, because they're sometimes in the reception area as well. And how do we do that? And I go back to the first time I had to phone 911. I remember that so well. I was taking my son to a Maple Leafs game in Toronto, and right at the intersection of Charlton and Yonge Street, This one car, I don't know why, went head on into a trolley car. And I mean, it was a vicious collision. And there's 3 phone booths to the right. And at that time, you didn't need a quarter. But I thought, should I phone 911 or not? The car burst into flame. People are obviously injured and so on. I went to the phone booth and very nervously dialed 911. The operator says, 911 operator, what's the nature of emergency? Police, fire, ambulance. And she had me on the line. I heard as she connected to the fire department, to the ambulance, to the police, and so on. And before I hung up, these, the sirens are there. It was amazing. Uh, know what to do before you get in that situation. I basically, when I had the practice, we'd only book 2 weeks in advance. We had a waiting list of new patients that wanted to come in. We just couldn't handle them all. Talk about being a practice builder. When you can help people out of an abusive situation, help them out of a domestic violence situation through my profession of dentistry alone, and you people can do the same thing in your own profession. Work together as a multidisciplinary team with all the other agencies that you have, and you can do the same thing. So my main goal is to have all the professions, all the modalities, healthcare, law enforcement, emergency measures, and so forth, share the knowledge that we have with each other, recognize key signs that each and every one of us have in our own modalities, know the mandates that we are bound by law, and hopefully you may not be able to save and protect the teeth and the smiles of your patients and clients, but save their lives and their lifestyles. By all means, yes, you can. So thank you very much for attending, and I'm open for any questions. Sarah or Barb, back to you for the questions. Thank you.
Well, first, I just want to thank you very much for that presentation. It was very informative, and we have had several comments thanking you and saying how valuable the information is. I just want to, before we get into questions, I want to acknowledge that was tough. We heard a lot of situations of abuse. We saw images of abuse. So please do reach out to get help, support for yourself if you're distressed by what you've heard and seen today. So you might consider talking to a friend or a colleague. And Sarah has put information about distress lines, where you can find information about distress lines, into the chat. So follow up on that if you need. So we do have some questions that came in through the chat, which I will pull up here and ask you. Can I ask people from now on, if you have questions, can you please put them into the Q&A at the bottom? So Frank, the first question is, does the Ontario College of Dentists provide any violence against women training to their members?
The Royal College does have, it's in the handout that you have. A lot of it is available online, especially with COVID right now. I guess about a year and a half, 2 years ago, I was able to get, for the dentists, the dental professional know, I was able to get a qualified Core 1 course in regards to abuse recognition. That is also available. Right now it's available through the ODA as well, and I think it's free of charge on this Core 1 course, 3 points, so it's there. And also with the ODA, it's in the handouts. There's a lot of information out there, even with dentistry. So take a look at the handout, and if anything, get back to me. I can help you out that way too.
Okay, thank you. So the next question is, I'm going to ask this one. It came up a couple of times, actually. So from your presentation, we understand that children who are victims of domestic violence would be reported without question by professionals. But do you need permission from adults to report? And what age are you referring to when you're talking about adults?
Good question. Adults, basically, according to the Child and Youth Family Services Act, 16 years of age and under is classified as a child. There are children that are still, various reasons, that still qualify between the 16 to 18 years of age. Essentially, anybody 18 years of age and over is looked at as being an adult. There are some cases, wards of the court and so forth, that a child can go up until 20 or 21 years of age, upwards of 25, I believe, as well. And they're still classified under that aspect. But you have to get permission from the adult patient And that was what those 4 questions were at the end. And again, the key to that is the guardian cannot be in your operatory, cannot be in your examining room, and so forth. They have to be outside. And I'll tell you, COVID, if any positive comes out of it, I'm so glad with that, because the rules in dentistry anyway is we cannot allow guardians into the operatories now because of COVID. So, but once you get the information, what we did when I went with those 4 questions, I put the freezing in, waiting that 5 minutes, went through the protocol. My assistant has a steno book, and she'd put the date in there as soon as we started the day. And it was a Q&A, question and answer, question and answer. And so that now became part of our record keeping as well. The patient gives permission. That's all they have to do is say, yes, I'll answer those questions for you, and so forth. And that now becomes part of the record keeping that we would have. So the adults, yes, you got to get permission.
Okay. Um, so a follow-up question that if you report a case, so this is coming from a health professional, and so the language is, how are we and our children and our family protected by retaliation from the parent, especially if you're collecting pictures? Even if the parent isn't in the room, they can ask the child and figure out where the report came from.
Again, good question. I've had several times the protocol we had in our operatory. As I got into this more and more, literally every one of our operatories had a panic button that we would push. The alarm company was told to respond non-uniformed police officers to the site. Maybe once or twice a year, we had to activate that system. The office, we had a different protocol, but at the same time, you will be protected by law. Check in the Child and Youth Family Services Act. You cannot be sued by anybody when you make that report. Going back to it, birds of a feather flock together. Usually it's the dad, for example, in the family unit, or the male partner. They are the ones who are the abusing. The mom is as happy to be taken out of that situation as the kids are. The system, law enforcement, the Children's Aid Society, the various shelters, and so on, will also protect you. Have I been threatened? Yes, I've been threatened, and that's part of the state of it. But I'll tell you, nothing has ever come of it. The protection is there from the law enforcement. A few times where we've had incidents even at the house, I'll tell you, I kid you not, 45 seconds to a minute, and I had law enforcement at the house. So you're on their computers as well as a kind of a category 1 response. And I remember once at one incident we had police officers said, we responded faster to that than we do to a bank robbery. You've helped us out so much. They're there. They'll back you up all the way through. So please, and birds of a feather flock together. That family will tell 15, 20 other families. You'll be so busy dealing with that. And there are ways that you can get compensated for damage to the dentition and so on at the same time. One thing while I'm thinking about that, as an adult, if the adult is in an institution, seniors, for example, if they're in a long-term care facility and you see something that's suspicious, if the patient is institutionalized, regardless of the age, that also qualifies for mandatory reporting. You must, as you're classified as a mandated reporter, you must report that.
Okay, so I think that answers a question that we had, that if you're dealing with an adult with capacity issue and you're concerned about physical abuse or neglect, you don't need permission to report. You said you have to report that. That's
right.
Good. Okay. So our next question is from a dental hygienist student, and it said they need to ask guardians for consent to proceed with care for children. And they're asking, in your practice, is there a way to gain consent without the guardian in the room with the child?
With that, what I did with the child, good question as well. If the child is, let's say, 8, 10, 12 years of age, usually in my practice, I would say 70% of the time it was the mom that came in with them. The mom was brought into the operatory. We went over the medical history with the child, with the parent or guardian there, and then they were asked to leave. And they went back into the reception area. And then with the children, there's different questions. If I saw stuff that was a bruise on the face or something like that, and that wasn't addressed by the parent, I'd ask the child. And I've had everything from the child saying nothing at all. They kind of look up at the ceiling and you see the tears starting to get in the bottom of their eyes. Or they say they can't remember. All that, we mark all that down. That's part of our record keeping. And maybe that first time, just because I saw like that one that you saw with the healing black eye, which ended up, being a major case itself. Um, I maybe would not report that right off the bat, but if they came in again a second time and another injury was there, now I'm getting suspicious. And it's not me to prove the abuse. I'd phone the intake worker at the Children's Aid Society, let them work at it. The thing is too that is it going to refer back to the dental office? Not necessarily, because the child goes to school, they take music lessons, they go to sporting, they're on a team and so on. That is the responsibility of the coaches, the teachers, and everybody else. They could have also reported that to the Children's Aid Society. And all of a sudden, the Children's Aid Society gets enough red flags, they're going to do the investigation, even of a minor injury. So don't be too worried that they're going to trace it back to you. The other part is, if you're really concerned, use Crime Stoppers. They don't want your information. If you have to document it to the Royal College of Dental Surgeons of Ontario, well, I should have reported it and so on, but I did it through Crime Stoppers. They give you a code number. You can release that to the college and so on. They'll keep it in confidence, but at least you did your part.
Okay, thank you. So again, I think it's more, somebody wants a bit of a clarification, what's something we've already talked about. You've mentioned that abuse is something that we should be reporting. So if a child had a number of cavities, but the family books all appointments and has the restorations completed, are those cases that should be considered neglect? Or is it when you diagnose and the work isn't completed that you have a suspicion of neglect?
The latter part, and especially now with COVID, kids have been locked up, they're at school now, but there's 4 or 5 months that went by, and there's a lot of decay that dentists now are seeing that has to be done. If you say to the parent, this needs to be done, that needs to be done, there's the decay, you go through the regular, getting informed consent. They said, okay, fine. Can we take it one at a time? We can't afford it and so on. Fine. At least they're getting the treatment done. It's when they absolutely refuse. Doc, they're only baby teeth. They're going to fall out anyway. Why should I spend all that money on it?
Right.
That case is definitely going to go.
Okay. And we have another question here. When parents come into a dental office from a long-term care center and their oral hygiene is very poor, is that considered neglect by the facility? Is that something to be reported? And where should it be reported to?
Right now, I did a lot of calls to the long-term care facilities. In a sense, maybe another positive aspect with COVID, I'm so glad that something along that line, because not all of them, but there are some long-term care facilities that I'll tell you, I would not want my parents or my relatives or even myself to be treated that way. It's unfortunate. I think you're going to see a big change in that field itself. But again, it's not just the seniors, it's the institutions. A lot of adolescents and teenagers and young 20s and 30s, car accidents, falls, sporting accidents. They get a brain injury and they're institutionalized to get to rehab and so forth. Those, if you see suspicious injuries, you must report that to the proper authorities. That would be the police. Same thing, that 92-year-old female that had the bite mark. To me, that's, in my opinion, still an active homicide case. And but again, unfortunately, in that case, the law enforcement did not. In fact, I told the son, get another police officer. We did had another one, and they said, well, she's 92 years of age. We got other cases and so on, and they are overworked. There's no question. But to me, if that was my mom, I'd want something done. That is not the way to go.
Thank you. So someone is asking, what if the adult does not give permission to report, but there are children in the home exposed to domestic violence?
With that, if the children are there and I have information that the child is at risk of harm, I have no proof that they are being harmed, that they're being abused. I don't know if they're being sexually, attacked. In fact, the Child, Youth, and Family Services Act says even the suspicion of sexual exploitation. I have information that in that house at 123 Main Street in Hamilton, there's 3 kids in there, and they may be, in a potential of harm. I would phone the CAS, no question, and actually even the police together. And we've done that a few times, even where I attended at the house with them at the same time. I remember one about 9:30 at night and went out. And it's your obligation. You're a healthcare professional. If that was my son or daughter and the grandkids that were in that, I'd want help sent out to them as well. So just the idea that if you suspect that they are being harmed, you must report that.
So we asked previously about a vulnerable adult that was not capable, but they were living outside of long-term care. And this person makes the point that there are many vulnerable adults living in the community. And so even if someone's not living, I guess the question is, even if someone's not living in long-term care, but they're not capable, is that reporting requirement still there?
I've had several cases like that. Excellent question again. In fact, Hamilton's like any community. You've got a lot of condominiums and townhouses and all that where seniors built specifically for seniors. With that, when I got indication that, and actually it was the next door neighbor that says, that dropped the elderly person off at the office and said, "Can I talk to you privately?" And says, "I think something's going on there," and so forth. And that's where in Hamilton we have police officers, victims of crime, and one of them, actually 2 of them here, are deal with senior abuse, and we got the senior abuse officer involved with it and so forth. And that was a proven case we had that resolved itself well. So yes, that's when you go outside through other agencies like the law enforcement and so forth. That's their job. It's like a 911 call.
Okay. So I think we've talked about this, but the questions come up again, so I think it's worth returning to. If a child is witnessing abuse, witnessing abuse in the home, is it reportable to CAS or to Child Protection Services?
If a child witnesses, okay, like Shania Twain, where she saw her mom being abused,
Yeah.
domestic violence situation.
Yeah.
If she came in as a child, said, gee, I hope mom's okay. And I ask her, well, what do you mean? Oh, dad did this and that to her last night. That is enough, with the child. Indirectly, I'm protecting the child because the child now is also the victim in that family unit, even though they're not being physically abused or any type of abuse. But if a partner or a sibling, I've had one case that we had 3 kids in the family, only one child was being abused, and that was actually the older sister that did report that. And again, it's, in my opinion, the interpretation all comes down, is the law enforcement people that have to explain how it is and so on. But I always say, look, if I was walking with my wife after supper tonight and around the block, it's a nice day, and I see smoke coming out of a window of my next door neighbor, and I knock on the door and so on, nobody's there, I'm going to phone 911. Maybe it wasn't. Maybe it was toast that was left in the toaster oven and burnt and so forth. Am I going to get charged for phoning in a false alarm? No, there was reasonable suspicion there. I did the right thing. You never know what's happening on the other side of that door. So I think if it went to court, you would still be, held. Again, it comes down, is there a malicious intent in that call being made? Yes or no? If there's not, I can't see the courts coming back at you.
Thank you. And so we had a couple of comments from listeners saying that in social work, you often ask if the abuse is happening in front of the children, and that is sufficient for reporting if the response is positive. And someone else says that if an adult shares that children are present, that warrants a report. So I think we've got some clear direction on that. Another question, are there consequences for professionals who report signs of abuse in an adult when the adult didn't agree to report that abuse despite clear evidence of abuse on the body?
Good question. I've had that happen several times. I go in the same way without, and asking about the questions. If they say, no, I don't want to answer those questions, I say, I'd like to get some more x-rays and so on. Photographs, that's part of the record keeping. A lot of dental offices take a photograph, the facial photograph of the people, pictures and photographs. Intraorally, we have cameras that can take an individual photo of the tooth itself in the mouth. That is listed as being patient records. That's record keeping in our field itself. So with that, I have the right to take the photographs in the same way that I have the right to take an x-ray and so on. If they are adamant, I'm talking the adult patient is adamant, no x-rays, no photographs and so on, as much as my job as a healthcare professional is to say, I need an x-ray to see what's going on, no, I absolutely refuse, then in my records, I say informed consent was asked for, was denied by the patient. Some offices even have a form, in a sense, as much as they say, I explained the root canal, the pros and cons of having root canal, patient signs off on it. They can also have a form that says, I've explained it, however, the patient denied consent. So that, again, protects you from that. I don't know if that answers the question directly itself or not, but as much as we have to inform, if the patient is, as an adult, is disagreeable to that, protect yourself, make notes that, no, they denied that.
Thank you. So a clarification for children 16 to 18, can you report without permission?
Check, in fact, get the Child and Youth and Family Services Act. Yes, if the child is, 16 and 1 day old, already falls into that area. I would err on the fact of going ahead and reporting it to the Children's Aid Society. Again, they're the investigators, and they won't go and say, well, we got a call from Dr. Stetchy's office and so on. No, they're discreet. They know how to go about that. And again, it might have been the teacher, it might have been the coach of a team, it might have been a schoolmate that reported in. I had that happen once. One of the assistants was actually a student, a dental assistant student, was in a supermarket and saw, I did the presentation, saw what she thought was bite marks on a young girl during the summertime, about 9 o'clock at night at the supermarket. And she phoned up the next day and I said, I saw this and that. And I said, what did you do? I said, I followed him. I said, oh my God, don't follow him, and so forth. But anyways, discreetly, she got the license plate number. She passed that to me. We passed it over. Quick and short of it, that child was being abused. And here, somebody not even graduated yet in dental assisting actually saved, in my opinion, saved that child from further abuse.
Okay, thank you. We have a question. If a dentist calls Child Protection Services, will they keep the name of the office anonymous, or will they disclose that the suspicion came from a dental office?
No, they'll keep it. They'll just say we've had reports of, we have to. They won't even say a bite mark. We have a suspicious injury report. We have to investigate. They will come in. A lot of children's aid societies have dentists that work with them. In Hamilton, we have the Catholic and the public children's aid societies. I've worked with both of them in different cases. But with that, no, the office is kept secret. However, if this is proven to be an actual a viable abuse case, they might call me in, for example, and what I need to know is, okay, gee, Barbara, she was the receptionist, she's the dental assistant. I have to ask you specific questions, in a sense, almost like on TV. You're my confidential informant. You're the one that saw that. I have to ask you from the dental aspect, what did you see? How did you see it? And so forth. So I'm the investigator, part of the multidisciplinary team, but that is done privately. We could do that after hours. The family doesn't even know that we've been talking. If it goes to court, I also will be the one who testifies on your behalf. So the staff member does not have to testify. I'm the one that goes to court, but I need your information.
Thank you. So we just have a comment from a participant that some clarification. The woman would report to police, but it's the police who actually lay the charges in domestic violence cases. It's not the victim who lays the charges. We have a comment that with COVID-19, there's a lot of people who are unemployed, struggling to support their families, and some who can't afford dental service, and their children's teeth um, are going bad or are having cavities. Do you have any comment on that?
Um, if you phone up the Ontario Dental Association, again, in the handout, it's an 800 number. They have different social programs for, especially for kids. Healthy Smiles is one program I can think of right off the bat, and it does cover things like that. The other thing that I've done is, if it's something fairly major, Healthy Smiles covers the basic things, the fillings and the extractions and so forth. I'm a Rotarian, for example, and I've gone to our Rotary Club and said, this family needs an extra $500,000 to get such and such done. The service clubs, Kiwanis, Lions, Optimists, they're there. There's other agencies outside in the community that can actually help you out. So reach out to them at the same time. Talking with the dentists, it's amazing. We've done pro bono dentistry as well. It's not just for the money. It's especially when it comes to kids, you want to get them out of pain, get them comfortable, and so forth. Even something as simple as, you got a decay on the front tooth, and the child is very embarrassed with that. Simple thing, get that fixed up. The child's smiling again, and so on. You've done wonders for them. So there's always a way there, but the Ontario Dental Association does have plans available.
Thank you. So I think it's a quick question. If Child Protection Services ask for pictures, can the dentist send them via email?
Good question. No, what I would do there is put it on a USB port, phone up CAS, have them send a worker over. They have identification, that almost like a police officer with the badges and so on, and have them pick it up. Again, the chances that it can be hacked, if you will, through the email, unless it's a secure encrypted line, which sometimes isn't always available. But better to do the same thing with the police. We had a couple of homicides here in Hamilton area, and I got the dental records and so on. I was the one who picked them up, signed off for them in the offices, and took them directly down to the police department itself. So with that, you need to have some protection, or at least some semblance of protection of those files and the privacy of them.
So this is I think a good question. How can you support patients so that they can tell you whether there is neglect or not? I guess if we're talking neglect, we're likely talking children. So how do you support somebody in your office, in your chair, so that they feel comfortable talking to you?
Good question. I guess it was always the way we ran the practice. My associates there, everybody, we really selected our staff well. The patients cannot be tricked. They know when you're telling the truth and when you're not. And like I said, the biggest thing there is the guardian does not come into the operatory. How many times I'd be at the hospital treating, dental injuries, falling off a bike and so on. The parents are not allowed into the room where I'm stitching them up and doing this and that and so on. The nurses are there to help me out and so forth. With that, it's trust that you have to develop in dealing with the patients. The best trust you can get is when the patients refer other patients. Like I said, birds of a feather flock together. They come in already knowing they can trust you, and you just don't violate that trust. It's kind of a difficult thing to really. Every practice is different, but again, the guardian's not there, and there'll be times they come in for a filling and we don't do a filling. All we do is talk about different things. We make notes of it all the way through. If it's an adult, we say, when you're ready to activate it, you want to lay charges, for example, you contact the police, let them investigate it, let them come in, see the evidence I have here. And it's true, the police are the ones that lay the charges, not the victims themselves. But again, you go to court, you're going to have evidence that says, yes, this is the abuse I sustained, and gather that. And then I guess it's that trust and the faith that they have in you as a practitioner, as you as a pharmacist, or anybody. What trust do we have that things are going to be done properly? Did the pharmacist really give me a flu vaccine the other day or not? You have to trust things all the way through. I don't know if that answers. That's kind of a difficult question to really answer.
It was a difficult question, but I think you did a fair answer there. So Dr. Stecchi, I really want to thank you again. We got through most of the
Mhm.
questions, but you have provided contact information. So
Yep.
if people had follow-up questions, and I just want to reiterate that we've got several comments thanking you for this, this presentation. Certainly on behalf of the Neighbors, Friends, and Families campaign and the Center for Research and Education on Violence Against Women and Children, we really appreciate the time and the information. And thank you to everyone who participated today, who asked questions, who listened to this, who will share this information out with colleagues and perhaps even use it in your practice. Thank you for joining us too.
Thank you. Thank you very much.